$4 million. It's a lot of money. How'd you like to get paid a bonus on top of your base fees? If you're a business owner, CFO, executive director, or nonprofit, imagine getting a bonus of $4 million. Well, usually that could be some good news, but in this case, maybe not so much. So don't believe a word I'm about to tell you. Do your own research. But Gallagher got caught, and every major brokerage is most likely doing this. I'm not saying they're all bad or they're all corrupt. I'm not saying any of that. I'm just saying this is public record now that this school district in Florida thought they were spending around 200 grand a year for advice and services, which they did pay, which was disclosed. But what wasn't disclosed was, whoops, 4 million from the insurance carriers. It disappeared. $4 million. Now, if you're like, I don't care, then turn the video off. But that's like, what's going on? Why is that? If you notice here, what happens is when you get these bonuses, you're influenced, whether consciously or unconsciously, you're influenced. I'm not saying fees and commissions are bad. I'm not saying getting paid a percentage of something is bad. I'm saying when you have a $4 million non-disclosed payment, that just doesn't smell right, right? It just doesn't feel right. And plus they're saying that the broker recommended Cigna, which they called a disaster. Now, I don't know what happened, but the point is that this is happening across the nation. And if you're okay with that, then keep doing what you're doing. Most people, I mean, imagine if you're a nonprofit and you're paying your advisor $50,000 for the commissions. And a lot of people don't even know what they're paying. So they dig in, they're like, oh, okay, they're getting $50,000. That sounds about right. That's about right. But you don't see the undisclosed bonuses. And where do those come in? Right here. This is a carrier that you would know. I stripped it out, although I don't have to. I'll send this to you if you want. It's what we get as brokers. I'll send it to you. But this is the bonus on top of. This isn't reported usually. And in some cases, these are just smaller cases, right? These are like 50 to 100. But their schedules, if you're an agency and you're writing $10 million a year or $100 million and you maintain that, the retention bonuses looks like this, right? Growth factor. So why is this important? The transparency that's happening now is growing. People are starting to question this, especially in that case. You imagine being in charge of that program and finding out that you were probably influenced to make different decisions based on $4 million. It's hard to ignore. Work with a broker that is a buyer's agent for you, not a seller's agent for the insurance company. That means we as the broker work for you. There's aligned interests that our costs, our fees don't go up as you spend more money. It's fixed, usually $30 to $80 PEPM, per employee per month on the medical plan. It's a fixed amount. Our job is to help make the plan better, contain costs going forward, and make the coverage better. Very simple. If you want a different conversation, I'm all for it. 15, 20-minute phone call. People are shocked when they start hearing this stuff. And I can tell you this, you do not want to be on the receiving end of a reporter calling your nonprofit board of directors or calling your company and finding this out. This is horrible. Like, you don't want to be in the news for this. You want to be in the news for stuff that's saying, hey, we took control of our healthcare, we did some things differently, and we aligned ourselves with the right advisors. I hope this helps. Check us out, millinggroup.com, if you'd like to learn more.